Good morning, everybody, and welcome back to your Lunch Break Live. Today is Monday, July the 12th. My name is Savannah if you are new here. Now, today it's a Monday. It's a rainy Monday, so we're going to talk a little bit about something that happened last week. Today, I am joined by our own columnist at AL.com, Kyle Whitmire, and Kyle wrote a column over the weekend that I believe many of you saw, and this was kind of in response to Alabama falling dead last in COVID vaccination rates. Now, that slipping from the second to last spot to the very last spot happened on Friday, and that is again from national data there. So again, Kyle, you wrote this column over the weekend, and that was after something that had happened earlier in the week, kind of here on AL.com. We had a story about UAB expert Dr. Jeannie Moratas saying that with the rise of the Delta variant of COVID-19 kind of becoming the more common strain of that virus, saying that hospitalizations are ticking up, and that could be a problem. Now, Alabama Governor Ivey then took the story from AL.com and shared it on social media, along with a statement saying that she was not very pleased that she had not been asked to comment on the situation, and also very much stressing that there would be no health orders coming forward, that there were no restrictions in the state as of today, and that she didn't expect any, saying, quote, "We are moving forward." So, Kyle, I know that that's kind of a quick watered down version of what happened last week, but Kyle, you took that on over the weekend. So before we get to exactly what you kind of said in your column, what did you think when all of this unfolded last week between Dr. Moratas, the governor, and our story on AL.com?
Well, first of all, if Kay Ivey wants to talk about these issues on the record with us, I'd be happy to sit down and do an interview with her on camera, for the paper, whatever format she wants. But it was curious how sort of testy that she got. I mean, the thing that I think that she's objecting to here was the word. I think the word lockdown was thrown around, or further restrictions. She came under a lot of fire last year for maintaining public health orders, the safer at home, the stay at home orders. And we are going into an election year right now, and she doesn't want to have to contend with all this again. But I mean, the point that she's missing, that that it was what Dr. Moratas was trying to say, is that, look, if we don't get our vaccination rates up, if we don't protect Alabamians from this disease, the disease don't care. The disease speaks for itself. COVID speaks for itself. And if this Delta variant it's already here. It's not if it makes its way to Alabama. If we don't prepare ourselves for it, it's going to become more and more of a problem. And we're going to be right back to where we were potentially this time a year ago. And nobody wants that. Nobody wants that.
Right. Now, and just for some context here, I checked the Alabama Department of Public Health, their surveillance and their data this morning. And as of this morning, there are 251 hospitalized COVID-19 patients. And that is, again, with the number of hospitals reporting. That might not be every single hospital in the state. So that's a disclaimer there. I will share that link as well if you want to go and look at this. But that's compared to June the 16th. So give or take a month ago, where there were 185 confirmed patients. So there has been an uptick there. And many experts say that uptick in hospitalizations and maybe in the future deaths is related to Alabama, again, being dead last on that vaccination kind of totem pole, that those are a direct correlation. So when you look at those numbers, and then the governor gets upset about that story, Kyle, what do you think was the impetus for that aggravation?
Well, I call it our mayor from Jaws problem. There's a lot of reason right now to feel very optimistic, and everybody's sort of coming out and going back out into restaurants and going shopping and trying to resume normality again. And yeah, I'm sure no one wants to hear an expert from one of our state's leading experts on this issue come out and say, it's not over with, folks. It's not quite safe yet to go out into the water. And I just thought first of all, it was a horribly timed comment for the governor's office to make, or a horribly timed response for her office to make, when you look at what happened the very next day. Alabama drops from 49, which I guess 49 to 50 probably isn't that far of a jump, but it is embarrassing. It should be embarrassing that Alabama is dead last in COVID vaccinations. We're behind the Virginia Islands, and they're not even a state. And whether or not we have an immediate public health risk because of that, which we do, it also just sends a really bad message nationally. I mean, she wants to talk about Alabama being open for business. That's great. But how do you attract business when the national headline or your brand, so to speak, is we're dead last in COVID vaccinations? That's just not going to work.
And again, like you said, now those comments from the governor's office came just a little bit before, a couple of hours, we can say, before Alabama dropped to the dead last. Again, not necessarily a lot of a margin there. We weren't that much ahead of Mississippi to slip into that last spot. But that came, it was an interesting timing that we can say that. And this is, again, some data that Dr. Moratas provided when we did that story earlier in the week. And again, she was not calling necessarily for any sort of restriction herself. She was just saying that there is a rise right now. She also cited, or data from UAB cited, that there was a 5-fold increase between June the 24th and July the 5th of hospitalizations there. Yeah. And that's a pretty big number in just 2 weeks. I'm not good at math, but that's less than a month. I think we can all agree that that is less than a month.
Well, I think we've all sort of set our baselines internally to what we saw in January, February this year. And we kind of look back and compare what's happening right now to what was happening 6 months ago and go, geez, it's not really that bad. But it's kind of like the old math problem of the lily pads in the pond. If they doubled every day, yeah, something that is appears somewhat small right now can become a very big problem in a very short period of time. I mean, that is exponential growth versus incremental growth, and that's what Dr. Moratas is trying to warn people against. Is that this is not something that we can turn our back on. And, unfortunately, we have just a tremendous amount of vaccine hesitancy in this state. It seems to be stronger here than it is anywhere else in the country. And sadly, I think we have a lot of people in Alabama who have become politically cynical and polarized to the point that we now believe that if someone from the other party or someone from the government is trying to do you a favor, there must be some kind of trick to it, that this is some kind of trap. They cannot believe that, no, this is something that might save my life or save a loved one's life and be good for me.
I spoke on, my days are running together, but I spoke on Friday with a member of the White House COVID team. This was Dr. Cameron Webb. He is the senior policy advisor for COVID-19 equity at the White House. And he said, look, this is rising. Delta variant's rising. He did say he was worried about hospitalizations and possibly deaths rising in a state like Alabama with such a low vaccination rate. And he just said, look, there are vaccines available. We are encouraging people to get them, and we're encouraging people to get the right information to understand and to make their own decision. He did say it's people's own decision, but if you decide not to get that vaccine, you are putting yourself at risk. Now, Kyle, we've got people that say, look, I have all of my information, and the information that I have says that I'm not going to get the vaccine. So what do we do with that amount of people in the state that then are we ever going to get out of this last rating of vaccinations, I guess is my question.
Look, you and I can sit here and tell folks to get vaccinated, and I'm not sure how much difference it's going to make. The point I was trying to make with my column last week is, if someone like Kay Ivey goes out there and speaks and tells people, you need to get vaccinated, you need to do this, these folks are probably more likely to listen to her. So that voice that she has carries further and persuades a different crowd of people. And so she has a responsibility with that. Now, that may ding her popularity a little bit, but she's got popularity to spare right now. And to his credit, Senator Tommy Tuberville's not afraid to go out there and be saying the same thing right now, putting out videos, encouraging people to get vaccinated. Nick Saban's doing it. I know he's not a politician, but he is a public figure in Alabama, and he's speaking out. We just cannot let up. Our public officials cannot let up on this issue, and just trying to reach every single person that they can, because the dilemma here for public officials, and I get this is a real test of leadership, because just like it was last year, the mitigation measures, in this case, the vaccine, look premature at the moment that they're most effective. When it becomes a problem, it's really too late. And if they're successful, they can often look like they were overreactions. So you get lots of people saying, oh, we shouldn't have shut down schools, or we shouldn't have shut down businesses. Well, we don't know how many people were saved by those actions. You look at what's happening in a country like India and what's happened there in the last few months, it may have saved a whole bunch of lives. So I get that this is a test of leadership for our public officials, but they've this is what they were elected to do, and they've just got to do it.
And again, you make a good comment that over the weekend, our Senator Tommy Tuberville, who is a Republican, who's a staunch Republican, and was actually supported by then President Donald Trump in the election, did come out and say, "Look, I got my vaccine. You should get your vaccine." And he did release this kind of PSA over the weekend, and had some pretty strong words about that.
Yeah, and he's been doing that for the last month. And Tommy Tuberville and I may not agree on a lot of things, but I think this is something that he's to be commended on. And, I'm glad that he's stepping out and doing that.
Well, and I will pick out one of these comments here. Catherine says that Alabamians will only listen to their football coaches on vaccinations. And Catherine, if that is right, Nick Saban is encouraging vaccinations. So if you don't even want to look at public officials and you want to look at your coaches, former coach Tommy Tuberville, now Senator Tommy Tuberville, and Nick Saban are encouraging those. And that's on both sides of the aisle, Alabama and Auburn. So Kyle, thank you so much for kind of explaining your column a little bit about what went into your mind as you were writing it, and just for kind of sitting down today with us and going over this with us.
Well, I appreciate it. Thanks, Ivana.
Kyle, thank you again. Everybody watching, thank you so much. Please be kind to one another, and we will see you tomorrow.